Hello, my name is Carol Brown. I'm an Excelsior College nursing student. Today we'll be given an IM using Haldolper medication. The patient's name, I'm going to check the MAR, is Melly Larson. Her date of birth is 1/1/1936. Per the medication administration chart, it indicates no non-drug allergies. The doctor ordered Haldolper 2 milligrams IM. I calculated that by, I looked at the medication. It does say 5 milligrams per milliliter. So we're going to use 2 of those milligrams. So 2 divided by 5. I used the calculator. 2 over 5 equals, it's 0.4 milliliter. So the next thing we're going to do, after I figured this out, is gathered all my supplies. I do have a sharps container, hand sanitizer, gloves, got alcohol wipes, and I did bring a gauze pad just in case after the IM. And I've got my medication, and here's my syringe. Oops. And I'm using a 25 gauge needle. And I do have tape here. Okay, what I'm going to do, first thing, I'll sanitize my hands. Let's do that first, get that out of the way. Okay, and here's my medication. Verified the expiration date. It's 7/2023. Haldolper, 5 milligrams per milliliter. And I'm verifying it again, Melly Larson, 1/1/1936, no drug allergies, and that is Haldolper, 2 milligrams per, and I did calculate 0.4. So we're going to go ahead and draw that up. Here's my syringe. The alcohol. Need to make sure the top is very clean. All right. Take off the tip. We're going to put 0.4. Air in. And then I'm going to pull out 0.4. There we go. Okay, so push it down to 0.4, right under the half. And I'm going to go down here and recap without touching it with my finger. That way I don't poke myself. And I'm going to take a piece of tape. We're going to mark the medication. It's Haldolper, 2 milligrams. On a piece of tape on the syringe. That way we know what we're doing. Okay. So we're going to go ahead and go into the room, get your gloves. alcohol. And make sure you bring Tamara with you, and just so you know, see it? All right. Hello, Millie. How are you today? We are going to do an IM injection of Haldopa. The doctor ordered medication for you to relax you. And I'm going to pull the curtain to provide privacy, get the patient comfortable. I'm going to check her armband. I'm also going to ask her, what is your name and date of birth? And then I'm going to check her armband. Millie Larson, 1/1/1936. Okay, and then I'm going to don my gloves. And we're going to do the IM in the ventrogluteal site. And I do have this I can use putting the medication in instead of putting it in the dummies. Okay, so we're going to position the patient on her side. And just to show a little bit of the area, put her on their side, and what we're doing is right here. This is the iliac crest, and we're going to be giving the injection right in between these two fingers here, if you can see me. And then right under here is the trochanter bone. You can feel the hip. So I'm going to check one more time before I give the injection. Okay, it is Millie Larson, 1/1/1936, no drug allergies. Excuse me. It is Haldopa, 2 milligrams, and it's 0.4 is what we're giving. And I'm going to be putting it in this so it'll be easier. And I have checked this. It does say Haldopa 2 milligrams. I'm going to go ahead and clean the area, which is right here. In a circular motion in to out. I'm going to leave the alcohol swab there so I know exactly where I'm supposed to put it. Okay, we're going to, with a non-dominant hand, I'm going to grab the area and make it taut. I'm going to put it right above and dart. And then non-dominant hand hold the syringe and then push it in. Pull it out straight up. And you're going to do the safety. And then we are going to put it in the sharps container. We're going to take that cloth and hold it on the area for a little bit. Make sure nothing comes out. Okay. Throw everything else in the trash that needs to be trashed. Take your gloves off. I'm going to cover her up. Lower the head of the bed, or the whole bed, to the floor. Make sure it's in its lowest position. Give her the call light. Let her know that you can call me if you need anything. All right, thank you. And then I'm going to leave. I'm going to do hand hygiene. Shit's dry. Then I'm going to take the MAR and I'm going to document what we just did, or what I just did. Okay, so, and then we are done. Thank you.